conference hosted by the Hispatia Hub. This year, we're joined by 75 participants from 10 ministries of health, 11 partner organizations, members from DHIS to core team at the HIS Center, and my colleagues from 7 HIS groups in the Asia Pacific region. Through the conference days, we aim to exchange ideas, share innovations, and strengthen our collective efforts in building robust information systems. We'll start with the participant introductions now. In interest of time, I'll be calling out the names of the organizations attending the conference, and I'll request the representatives to please stand and receive a warm welcome from all the participants. So we'll start with the Ministries of Health first. So we'll start with the host country. So I'll request the representatives from Ministry of Health in Vietnam to please stand and receive a warm welcome from us. Ministry of Health Vietnam. Okay, they're not here right now. So we'll move on to the next country, Minister of Health Lao PDR.
Can you hear me, or maybe I repeat my yes. Morning, everyone. My name is Thủy Phạm. I'm from USCDC Vietnam. We already support for the Ministry of Health in Vietnam in the many health sector and strengthening the health information system. Currently, with support by the uh, HISP Vietnam, we already support for Ministry of Health to develop the data warehouse in the national center and the regional center. We all know support to develop the event-based surveillance, and maybe in the near future we continue support for the indicator-based surveillance using the DHIS tool. Nice to meet you, all of you, and I will hope can talk more with you or learn from you about the system using the DHIS tool in from our country. Yes, thank you.
Thank you. So I just wanted to clarify. So I'm sure we'll have a lot of time to introduce ourselves and the work that we're doing in our tea and coffee breaks and lunch sessions. So for now, I'll just request you to stand while I call out your name and then receive a welcome from all of us. We'll have formal introductions during the breakout sessions. So next, I'll request the representatives from Minister of Health Cambodia. Please stand. And Minister of Health Lao PDR. Minister of Health Bhutan. Minister of Health Pakistan. Minister of Health Indonesia. Minister of Health Maldives. Minister of Health Occupied Palestinian Territory. We have new members joining with us. We have Minister of Health from Papua New Guinea and Minister of Health Sri Lanka. Next, we have a big group from WHO, from headquarters in Geneva, from Southeast Asia Regional Office, WHO offices in Lao PDR, Occupied Palestinian Territory, Vietnam, and Cambodia. So I'll request the WHO contingent to please stand. Colleagues from UNICEF. UNFPA. We have colleagues from World Bank. We have colleagues from FHI 360, JSI Research and Training Institute, US CDC Vietnam. We have from Nepal Standards and Interoperability Lab, Catapult Digital, Nepal Health Research Council, and International Organization for Migration, IOM. We have DHIS2 experts from the HIS Center at UIO, so requesting all UIO colleagues to stand, please. We have the HIS colleagues here, so his group, Vietnam and Laos. Bangladesh, India, Indonesia, HIS Pakistan, Middle East and North Africa, and HIS Sri Lanka. So once again, a warm welcome from the Hispatia Hub to all the participants. For the next session, I'll hand over to Anu to take you through the conference agenda. Thank you so much.
Yes, thank you, Saurabh. So I would like to go through the agenda for today. So for our first session, there will be a welcome from HIPS Asia Hub. We will learn more about Global HIPS Network. There will be a signing of HIPS principle by HIPS Asia Groups, and we will learn more about the regional HIPS Asia Hub model. And from 10:30 to 11 a.m., we will have a group photo and a short tea break at the foyer outside. And then we will continue with a review of new and upcoming features in DHIS2. Then from 12:30 to 1:30 p.m., we will have a buffet lunch at a restaurant on the third floor. So we will have 1 hour for lunch. And our afternoon session will start at 1:30 p.m., which we will hear from a number of countries who will present on their local DHIS2 implementations. We will have another short tea break from 3 to 3:30. And then from 3:30, we will have what we call parallel sessions. So we will have 2 parallel sessions. So at the same time, so session 1, we're focusing on ICD-11 for morbidity and mortality. And session 2 is focusing on education and health. So our session Yes, sorry about that. So our session for today will end around 5 p.m. And then we would like to invite all participants to our gala dinner on the restaurant on the 25th floor, which will start around 6 p.m. So regarding our parallel session, we would like you all to scan the QR code I have up here for Menti. We would like to ask about your opinion of which session that you want to join today, which our agenda will be adjusted based on the session that all participants wants to join. So yes, please. Yes, so I would like to go to the first question. So for the first day session, so there is 29 participants who want to join the ICD session and around 19 who want to join the health and education session. I'm sorry, I forgot to review the agenda for the parallel session for the second day and the third day. So these are the session for the second day, which is tomorrow. So we have data quality and metadata toolkits, which around 32 of our participants prefer to join, and then other 16 wants to join on the system assessments and the core team. And for our last day parallel sessions, we have visualization tools in DHIS2, which around 21 participants would like to join. And then we have a parallel session on integration, which we have now 28 participants. Yes, so thank you all participants for participating in our Menti survey. And I would like to present you all a useful links for this conference. So the QR code on the left will be where you can get all our materials and recording for this conference, and the QR code on the right is where you can share your photos of the conference. And another note from our organizer, so for the Wi-Fi of this conference, please connect to DAP 2024. So I will leave this slide here, and now I would like to invite Hyung on the stage to review on the logistics.
Okay, I apologize. I noticed there's a bit of an issue with one of the links on the left-hand side here. So what we're going to do, we'll just send you an email with the links, both of these links, both with the materials and recordings. I'll do that right now, okay? That way you can access. We've uploaded a number of the presentations already, so you'll be able to follow along with us if you want to access any of those. And of course, if you want to access them after the conference, we'll make sure to upload the material there. Same with the picture link. If you're not able to access it through the QR code, we'll also share that both those links in an email right now. And then you can just open those up. You can upload pictures, any of the pictures that we take, including our group photos or any of the other professional photography. That'll be uploaded there, and you'll be able to access that as well. Okay, so I apologize if these aren't working for you, but we will share links to your email in about 5 minutes, okay? Thanks.
Good morning again. I would like to, on behalf of HISP Vietnam, I would like to welcome you again to Da Nang City. In Vietnam, all Vietnamese consider Da Nang as like the most deserving city to live. Anyone who travel to Da Nang would like to stay here forever. And Da Nang also have another nickname is a city of bridge. I hope that from your room in the hotel, you can see to the back side, opposite side of the beach, there are so many bridges everywhere across Han River. So we do hope that go along with the conference, you will have a good time to enjoy this most deserving city to live in Vietnam. So I would like to introduce to you some logistic information. Earlier, my colleagues, Anu, already go through the agendas with all the practical information for today, like where is the lunch and where is the dinner. You can go back to the agenda to see some other practical information is that I would like to introduce the outside. We will have a toilet at the end of the entrance. When you get out of the elevator, there will be 3 toilets there for you. And at the tea break, we will have a tea break at the foyer outside here. And before the tea break, I would like to invite all of the participants. We will have a group photos. And the lunch will be served as a buffet at the third floor, 1 floor down here. And after the conference today, we would like you to have a welcome gala dinner, which will be organized from 6 p.m. at 25th floor. All the participants, even you live here or live outside of the hotel, will be invited for the gala dinner at 25th floor from 6 p.m. There will be music and dance served there. So I really do hope that you can sing and enjoy the dance with all the participants from all over the world. So then that is some practical information only. I always be here and sit outside there. Many of you would like to make the payment, but this morning I'm very sorry that I'm very busy. We cannot make it. But during 3 days of the conference, feel free to reach me and do the payment, okay? And so now I would like to introduce Anu will come back to the stage.
Right, thank you. I'm looking forward to the dinner already. So for our next session, I would like to invite Ula to come up on the stage for our